I'm Sue Dickman, CEO of the Jewish Communal Fund, and I want to welcome all our fund holders, and I thank you for joining us today. JCF is deeply committed to providing resources and information to help you be more effective with your philanthropy. Throughout the COVID crisis, we have offered webinars to help you understand its effects on the entire New York area and on our Jewish community. About a year ago, UJA-Federation, Met Council, and Self-Help presented a webinar on the Jewish response to the COVID crisis that focused on urgent needs like food, poverty, and homelessness. Today, UJA has again graciously offered to update us, providing a high-level view of the impact of the crisis 1.5 years later. Today's speakers will delve into areas that were not addressed in our previous program. We'll hear from two experts. Emily Sigalow is Executive Director of Impact and Performance Assessment at UJA, who will share key findings from the UJA-Federation COVID-19 Impact Report. And Rivka Nissel, Director of Jewish Community Services, the Jewish Board, who will speak about how this data relates to what they are seeing on the ground in terms of mental health and poverty, and share some client stories. And now I'm going to turn the program over to Alex Roth-Kahn, Managing Director of UJA's Caring Department, who will give us some background on the study.
Hi, I'm so happy to be with all of you today on this, I believe, 4th day of Hanukkah, maybe 3rd. I think we're approaching the 4th night. Anyway, it's wonderful to be with this crowd and to have an opportunity to talk about such an important topic. We at UJA-Federation and perhaps others have cloned this world in which we're now living as the long tail of the pandemic. And what we are coming to see in the field and our grant strategies truly reflect is a deep and surprising heightened awareness around mental health issues, particularly facing children, adolescents, and their families. Over the course of the past 2 years, from March 2020 through really the summer of 2021, when addressing mental health issues, we focused primarily on those affected by unemployment, social isolation in the case of the elderly and the most vulnerable, victims of domestic violence, individuals who are moving towards substance abuse. And our grant strategies reflected support of those populations. Over the summer and in anticipation of the fall, on the planning side at Federation, we were really inundated by day schools, anticipating needs for the launch of school, as well as summer camps in our area and residential camps throughout the United States. The stories they shared with us were of kids who, by and large, had been sheltered for the past 2 years and emerged on the scene at camp for the first time in a long time, trying to rebuild social connections and find themselves. And they presented a troubling amount of challenges in the areas of depression, anxiety, body image issues, questions about sexual identity that they hadn't been able to grapple with. And the camps were really unprepared to handle the needs that were in front of them. And this translated to the schools. And so our work over the course of the past few weeks, months, has been to rally our own internal resources to build up support for this student population and for their parents through increased support of psychologists in youth-facing institutions, through interventions that provide more training to educators and to parents, towards interventions that promote parent and child bonding. These are areas which we are putting many resources above and beyond our annual allocations so that we're able to more meaningfully address what we're seeing in community. what my colleague Emily is going to share with you in just a second are troubling statistics facing multiple demographics across a very wide age continuum in relation to mental health needs. And some of what she's going to present, we're also moving the needle on. But really at this time, our primary focus is children, adolescents, and families. And I'm sure that you'll find Emily's data very compelling.
Alex, thank you so much. What a wonderful welcome, and I'm really delighted to be here today. I'm going to share with you my screen so I can walk you through some of the findings from our new study. We're really delighted to be able to share this with you. This was the culmination of about 18 months worth of work. So, so a lot of work on our end, and we are really just excited to be here at this moment. So the way that what I'm going to walk you through today is I'm going to spend a few moments going through the study design, how we collected the data, and what the survey is all about. And then we're going to go into the findings. I will focus on Jewish life during COVID, financial and material hardship, mental health and well-being, and then we're going to close by spotlighting a couple population groups that really stuck out to us as being especially at risk. So the study design, for those of you who might remember back in 2011, which was the last time we did a big community study in New York, we partnered with a survey team, and what they did was they used a methodology called RDD, random digit dialing. So they randomly called households in New York and tried to find Jewish households through the telephone. Fast forward now to 2021, and we know that many people don't have landlines, and many people, like me, don't answer their cell phones when somebody calls and they don't know the caller ID. So we adopted a new methodology called ABS. Survey methodologists really like acronyms. ABS stands for address-based sampling. So this time around, what we did was we partnered with our survey firm, and rather than calling our survey partners, randomly mailed invitations to participate in the survey. And they mailed those invitations to 158,218 households in our UJA catchment area. And then that funneled down to a sample size of the survey of 4,400 adults in Jewish households. I'll just take a moment to give some context to that sample size. It may not seem robust, but actually, in fact, it really is. The Pew study, which was a national study done in 2020, their sample size was around 4,700 for the entire country. And so we have 4,400 just for New York. The study was really recent. It was fielded from February to May 2021, so this past spring. And the focus of the study was on COVID impact, which is different than our traditional community studies, which were focused on population estimates and numbers of Jews in our area and in Jewish households. And finally, the last thing I'd like to mention is just that the survey really relied on an expansive definition of a Jew. So if we look at this funnel, what the filter was that narrowed everyone down was a question that was asked of the respondent that said, do you identify as Jewish in any way, religiously, culturally, ethnically, or by family background? Or do you live in a household with somebody who identifies in that way? If the answer was yes, and they were invited to participate in the study. So we didn't impose any sort of halachic or Jewish law-based definition of Judaism to be part of the study. And one last thing, when we mailed those letters to the different New York households to participate in the survey, the letters directed the respondents to a website. So most of the respondents in the study took this survey online, either at their computer or on their phone. Although there were some hard to reach populations, and those hard to reach populations got they got hard copy surveys sent to them in the mail, and they also got phone follow-ups in various languages too. This map here shows the area in which we sent invitations and the areas in which we collected data as part of the study. So this is our UJA catchment area, the 8-county area. And then the areas that you see that are in color are areas that we intentionally oversampled so that we would have a sufficient number of responses to do more drill down analysis. The areas in gray are areas that we didn't intentionally oversample, but that we do have sufficient sample size that we can drill down and know something more specific about those neighborhoods. This list here, 1 through 14, is a list of all of our topic areas that we covered in the survey. I won't walk through all of them. I will just note that the last two, which were in blue, the anti-Semitism and the inclusion and discrimination, were addendum topics to the survey. Neither of those topics are specifically COVID related or COVID impact related, but they were areas in which we had questions around, we had planning needs and we're developing new bodies of work, and we needed more data. So we added on batteries of questions for both of those topics. I'm not going to present about those here, but we have that data and are glad to have further conversations about it at another time. So without further ado, our first finding is that this is a bit of a bright light for in this presentation. We're going to start off on a good note. We found that the pandemic has strengthened New Yorkers' attachments to being Jewish. So about 20% of Jewish adults indicated that their attachment to being Jewish has increased since the start of the pandemic. 77% said there was no change, and only 3% said it got weaker. And then we asked a question about if being Jewish has helped the respondent cope during a time of crisis. And we found that over half of Jewish adults indicate that being Jewish helps them cope during a time of crisis. 34% said significantly, and 19% said moderately. And what's interesting is when we break that down by age, we see this age cohort, 35 to 49, that 43% of Jewish adults felt being Jewish significantly helped them cope during a time of crisis. What this suggests to us is that the age in which people are forming families and have children living in their homes is an age in which they're leaning on being Jewish to help them through the pandemic. Many of my colleagues and I shared this worry. We were worried that about our synagogues and whether they were going to lose membership over the course of the pandemic. And we found that there was only a slight decline in synagogue membership. It declined by 3 percentage points during the pandemic. So before the pandemic, 37% of adults in Jewish households reported being members of a synagogue. And during the pandemic, that number dropped to 34%. We also heard anecdotally that there was a lot of synagogue switching and shul hopping that was happening during the pandemic. So we asked a question about that, about if the respondent had attended religious services at a synagogue outside of their home synagogue. And we found, in fact, actually 56% of synagogue members attended religious services at another synagogue. And this synagogue switching, hopping, was happening most especially among the Orthodox, with nearly 3/4 who reported attending religious services at a synagogue other than their home synagogue, and especially among the younger age cohorts, with almost 3/4 of those between the ages of 18 and 35 also saying that they were attending religious services at a synagogue other than their home one. And then we asked a question about online Jewish programming. We know that so many of the agencies and the organizations that we partner with and support had pivoted to online programming during the pandemic. And we wanted to know whether or not those online programs were working, whether they were helping people feel connected. And what we found is actually, yes, in fact, these online programs are working. 86% of Jewish respondents who participated in a Jewish program online during the pandemic said that their participation helped them feel connected to other Jews. And what was interesting to us too is that when we break that down by age, we see that the online Jewish programming was especially successful among the older age cohorts. So 46% of those between the ages of 65 and 74, and 41% of those over 75 felt that participating in an online Jewish program helped them feel a lot connected to other Jews. Ooh. Okay, now we're going to move on to our next section of findings, and this is when the light begins to dim a little bit in terms of in terms of the story. So we found that there was significant material hardship and unemployment within the New York Jewish community in 2021. We found that 1 in 7 adults live in poverty, and 1 in 10 were near poor, And when you put that together, it's nearly a quarter of adults in Jewish households live in and around poverty. And we found that 15% of adults in Jewish households were having a harder time making ends meet since the start of the pandemic. And when we break that down by different population groups, we see that the pandemic was had a differential impact on different people in our community. So those people who are non-white, who are Hispanic, Black, Asian, multiracial, and other, report worse financial situations since the start of the pandemic, as do the LGBTQ members of our community, and perhaps not surprising, the unemployed. And now when we look at the unemployment rate, we found there was a 12% unemployment rate for adults in Jewish households, which compared to about a 10% overall unemployment rate in our same catchment area in the general population. Just to note that 12% and the 10%, the margin of error on the study is about 2.5%. So this is within margin of error, which is just to say that the Jewish community fared very similarly to the overall New York community during the pandemic in terms of unemployment. But we really do see that the unemployment was much more significant in the city than in the suburbs. So the city counties are much higher than Suffolk and Westchester and Nassau. We also asked a question about change in employment situation and whether or not the respondent's job had changed, whether they got laid off, furloughed, and had their hours of work reduced or lost income. We found that 22% had their income or hours reduced, 8% laid off, and 12% were furloughed. So our next finding, section is about financial and material hardship. And we found that the unprecedented government and philanthropic support have successfully reduced the rates of food and housing insecurity. However, as relief efforts subside, we suspect that these rates are likely to rise. My colleague Alex can speak more to this, but we know from our agencies that they've seen like a 400% increase in demand, let's say, in Met Council for food. And what we see when we look at food insecurity, however, is about 9% of adults in Jewish households report being food insecure during the pandemic. So we know that there's a demand for more food, and we know that more and more people are turning to our agencies to get food. And what this data is suggesting is that those interventions are working. They're holding food insecurity at bay. That is not to make light of the fact that 1 in 10 adults in Jewish households are still food insecure, but we would anticipate that number would be much higher without the interventions that we have in place. I think some of the troubling findings are among those 9% of adults who are food insecure, because 60% are not seeking help, and about 50% report that they're not seeking help because they're too embarrassed. Our housing insecurity, we found that 4% of adults in Jewish households were behind on rent and mortgage, and that these higher rates of housing insecurity were especially high among the Hispanic, Black, Asian, and multiracial community, the non-white community, and especially among the Hispanics at 11%, single parents, the poor, and the unemployed. Okay. Our next battery of findings relates to mental health and well-being. We found that problems with social isolation, mental health, domestic violence, and substance abuse were substantial, and they've been exacerbated by the pandemic. So more than half of adults in Jewish households feel socially isolated. And these socially isolated adults face a range of other struggles. They report higher levels of depression and anxiety, higher rates of substance abuse, and a higher incidence of relationship violence in their households. And when we ask questions about mental health, we found that 1 in 5, so 20% of adults in Jewish households are reporting symptoms of anxiety or depression. And we used a clinical scale that we borrowed from the American Psychological Association to screen for anxiety and depression. So this is a clinical reporting that 20% have these symptoms of anxiety and depression. We also found that about 20% feel more down, depressed, or hopeless since the start of the pandemic. And I think potentially most troubling is that half of the adults with symptoms of depression and anxiety are not seeking professional help. And this not seeking help is especially problematic in the suburbs. So 46% were not seeking help in the city and 61% in the suburbs. And we can also see that mental health really varies dramatically across different population groups. So these numbers here are those who report symptoms of anxiety and depression. So we see at age that the younger age cohorts report considerably higher symptoms of anxiety and depression. The LGBTQ members of our community report much higher rates of depression and anxiety. Almost 50% of the LGBTQ community are reporting those symptoms. The non-white community, the Hispanic, Black, Asian, and multiracial community is reporting higher levels of depression and anxiety, as are the unemployed, those whose job has been changed. And in this lower right graph, which I think is an especially interesting graph, is that we asked questions about whether or not the respondent had close friends or family that they could rely on for help. And you can see that having social ties and having a community is really important to people's well-being. So those respondents who had no social ties, not a single person who they could rely on, friend, family they could rely on for help, 60% of them reported symptoms of anxiety and depression. And those who said they had 10 or more social ties, only 12% reported symptoms of anxiety and depression. And domestic violence. So this was a new question that we asked this year because we knew anecdotally that DV was on the rise during the pandemic. And we found that 4% of adults in Jewish households experienced violence in their close relationships within the past year. And I'll just make a note to give you some context here. The national statistic about domestic violence is 20% of Americans have experienced domestic violence over the course of a lifetime. So this 4% within the past year is a pretty significant number. The 34% said that violence worsened during the pandemic, and 64% said that they're not planning to seek help. And then we asked questions about substance abuse, and we found about 1 in 10 adults in Jewish households indicate that they have a substance abuse problem, and again, especially problematic, 86% did not and are not planning to seek help. And 72%, nearly 3/4, indicated that their substance abuse worsened during the pandemic. And I'm going to close here with some population groups that really stuck out to us as being especially at risk. Those groups are the LGBTQ adults in our community, the Hispanic, Black, Asian, and other diverse adults, other racially diverse adults, and those who are socially isolated. So the LGBTQ adults in our community were hit especially hard through the pandemic. This is kind of a summary of a lot of the things that I mentioned before, but their financial situation was worse worse than the overall community. They had higher rates of unemployment, more likely to lose a job, more likely to experience worsening mental health, higher prevalence of relationship violence and substance abuse. Why is that? Well, a lot of these issues that and these struggles that the LGBTQ community faces predate the pandemic, but we know that the pandemic has also exacerbated it. And the reasons for this largely have to do with the stigma, discrimination, and less social support for this community. We also found that racially and ethnically diverse adults in Jewish households experience more hardship than white adults. So these diverse adults are more likely to be poor and near poor, more likely to suffer financially during the pandemic, and more likely to report symptoms of depression and anxiety. And those who are isolated were much more likely to experience struggles, because social networks are an important protective factor in well-being. So you can see the numbers around anxiety, depression, substance abuse, and relationship and violence from those who are isolated, those who had very few social ties, to those who were not. And we also found that small social networks were also related to higher rates of being food insecure. And now I'm going to stop sharing my screen, and I'm actually going to walk you through on a quick tour of a website that we built that showcases all of this data. It is our hope that we will be able to, that you will be able to use this data and learn from it and explore it on your own. Rather, we had an option of In the past, I should just say, in the past, what we had done is with these big community studies, we produce reports, sometimes with 500-page reports, and we knew that nobody had the patience to read such a report. So instead, what we did this time around is we built this website to showcase the data and to be a clearinghouse for the reports. So this is our landing page for the study, and it tells you a little bit about the study, what we did, what the topic areas were. There's a reports page, so if you'd like to read the reports are all sitting in here, and you can download them as PDFs. And then we also built a data tool. So the data tool looks like, and I'll take emotional well-being. They look like these fun little data cards. And what happens is these are the overall statistics as they relate to our community. And if we click on one of these data cards, we can begin to explore the data a bit more. On the right-hand side, it explains how we measured the data. So this is what I was talking about earlier about the clinical definition that we use and the clinical screening tool that we use to study anxiety and depression. And let's say we want to break down this data by, let's say, age. We're curious to know what the age breakdown is for those who have symptoms of anxiety and depression. And so now we can break this down by age. And this is really neat because it tells us now that we can, that those who are between the ages of 18 to 34, about 30% of them experience symptoms of anxiety and depression. And we begin to see how this is patterned by age. But let's say we're really interested in Manhattan. We can filter by Manhattan, and now we can look at, it gives us our overall number, our overall Manhattan number. And now this is Manhattan broken down by age. And we can say, oh, wow, young adults in Manhattan are really struggling here. That's nearly 40% are experiencing anxiety and depression. So we can, then if we go back and we clear this out, we see all of our cards, and the filter will stay unless we clear it by Xing it out. So this shows us all of our data points filtered by Manhattan. So we can go through and we know this is the poverty numbers in Manhattan, unemployment, food insecurity, and down and down. And we can clear this out, and then we can filter by any of those same categories that we saw before, which will then apply across all the cards. I'm glad to send you the link to this data website, and I hope that it is of use and provides some knowledge to the community. And I think with that, I'm glad to take any questions. Okay, I see there's one question in the chat. What can be done to encourage people to seek help for depression and domestic violence? As a funder, what can I be supporting to make this help more accessible? I was just going to say, maybe Alex wants to respond to that.
It seems that I can't start my video, but is it something related to the webinar design?
I'll fix that here. Do that now.
Okay, great. So I put into the chat on this point, we're working to expand the capacity of Met Council's domestic violence unit, as well as the Shalom Task Force's outreach efforts. These are two organizations that are deeply rooted in the Jewish community and are providing significant support right now for victims of family abuse, of domestic violence abuse, of elder abuse. In one of the statistics that Emily reflected on is the fact that so many people, majority in fact, of domestic violence cases are not seeking help. So many of our strategies at the current moment relate to utilizing volunteers through the hypothesis that volunteers create a less stigmatized approach to seeking help when they're able to pound the pavement, position themselves in community-based organizations, whether it's JCCs or synagogues, and hold somebody's hand in the pursuit of getting care. This is often a more effective strategy in enabling people to connect to our system of providers. In relation to depression, and other mental health concerns. The significant partners under the UJA-Federation umbrella, where we turn regularly to expand support in the community, include organizations like OHEL, Jewish Board, Westchester Jewish Community Services, and a number of other community centers that really look more like settlement houses in their ability to provide comprehensive mental health support. And it's a great opportunity to actually turn it over to our colleague from Jewish Board, who can share more of the experiences that she's having at the moment as a provider, and we'll give you a flavor for direct interventions.
Thank you, Al. My name is Rivka Nissel. I am the Director of Jewish Community Services at the Jewish Board, and have previously spent 17 years working in outpatient mental health in Brooklyn, where we provided psychotherapy services to children, adults, individuals, families, and also provided clinical intervention services to yeshiva day schools. Under Jewish Community Services, we are also providing services to the broader New York Jewish community, and we are providing services in synagogues and JCCs. And so I'm really grateful to be able to have an opportunity to give you the human face and side of the statistics and what it was like on the ground during the pandemic, and really seeing such a tremendous influx of need from individuals with significant mental health presentations. So I am going to share my screen with some slides just to give us some context. I had so much to share that I tried to formulate it and put it down into some slides just to orient myself. I wanted to start by saying that we have made a really big shift in this pandemic experience, where we are going from coping or trying to survive and hoping that we are going to get to some form of an end where we can then look back and say, how was it and what was the impact, to really living with a pandemic. And in light of that, I believe that the mental health numbers are going to consistently shift because we are living with something that is chronic and prolonged. And so while this data is really significant, I also anticipate that the picture is going to be ever evolving, and we are going to have to continuously reassess what is on the ground. And, you know, we talk about living a new normal, and that new normal is not normal. And it's really important to underscore that there are a lot of people who have not been able to get back to a type of life that feels like the one that they had previously before the pandemic hit. I'd like to frame the increase in mental health symptoms that you've seen from the statistics from a traumatic stress lens, because I think it can really give light to why is it that we are seeing such a tremendous increase. I can tell you from the clinics across New York City have seen such a magnification of people who are seeking services that they have not been able to meet up with the capacity as quickly as the need has presented itself. And that the amount of people that are reporting such a wide array of mental health symptoms, why is that happening? And so when there is a threat, our brains have been programmed to be able to discern that threat and then to activate certain hormones and chemicals in our body to be able to respond effectively to that threat. And that is called the fight and flight system response. And what that does is we have adrenaline and cortisol that gets released to help us respond to a threat. So if we are in active danger, this bodily response is very helpful. So if a car is careening down the street and I'm in the way, my fight or flight response is going to help me get out of the way. If I am about to get attacked, if something is imminently in danger to me, I will be able to respond. However, what happens if there is threat everywhere through the media, through messages, through what I see in the paper, on my phones, what I can and cannot do? Our minds and our eyes are actually very perceptive in looking out for threat. That is how we've survived as a species. And so we are actually inundated with a stress response. And if we do not turn it down, what we actually see is, and also we don't necessarily have the ability to fight off something. We don't have the ability to flee, to run away. And so we're actually stuck inside our bodies with a lot of adrenaline, cortisol, and our system, which is mobilized to respond to a threat that's actually here to stay. And that will then result in a multitude of mental health issues like anxiety and depression, and people seeking ways to mitigate those symptoms through substance use and other types of acting out behaviors. One of the other things to keep in mind is that if someone has a prolonged exposure to a traumatic stress, and they also have other risk issues like poor social supports, food instability, food insecurity, housing instability, or they are from some type of vulnerable community, that they are more likely to develop PTSD. And that is something on our end that we are noticing is very high levels of traumatic stress symptoms and levels of PTSD. I'd like to take you now more into the stories, or really what it was like for us and what we are noticing. The numbers on their own are just numbers, and stories on their own are just stories, and they're not validated. But I think that the fusion and the beauty here, and why I'm so excited to be speaking more to this topic, is because of the fusion. So how did the pandemic impact mental health? And the most prominent feature of traumatic stress response is anxiety. And what we were seeing were tremendous levels of anxiety and fear that was immobilizing, that presented in panic attacks, that presented in children really decompensating, so not being able to function at age-appropriate level. That would include a lot of regressive behaviors, sleep disturbance, not being able to focus on school or participate in their remote school options. We saw adults who were not able to cope under the tremendous stress, and were also, it ended up either magnifying or bringing out pre-existing mental health conditions that were actually stable. So for example, we had a family where there was a parent who was stabilized on medication to treat bipolar. The level of stress and anxiety that the father was experiencing from losing his job prompted him to regress and have more pronounced bipolar symptoms. And what that did for the children that we were treating was that was so terrifying to them. And so when children are seeing their parents not coping, their parents struggling with mental health issues that they've never seen before, that is very scary. We also saw for a lot of children, fear of leaving their homes, fear of their parents leaving the home, fear of, is something going to, and this is across the board for all ages, am I going to get sick? Is someone else going to get sick? What's going to happen to my loved ones? The level of confusion, the constant changing of rules, and the nonstop access to media reports really is what perpetuates and still continues to perpetuate this anxiety and fear. Loneliness and disconnection. As humans, we are hardwired for connection, and it is essential to our survival. And it's actually an antidote to the fight or flight response, because that when we are connected, it actually releases feel-good hormones. And that is what allows us to regulate. And during times where still a lot of people are experiencing a lot of disconnection, loneliness, being disconnected from resources, not being able to still engage in a lot of coping strategies that they used to before the pandemic, is something that we are noticing. Depression is also very interesting because there's another side to the stress response where sometimes fighting is not an option, fleeing is not an option, and so we freeze. And so depression is the immobilization. And what we saw for a lot of the clients that we were working with was just very low levels of motivation, not getting dressed, not getting out of bed, sleeping too much, very sluggish, not being able to just take care of regular household responsibilities, poor sleeping and eating patterns, which ends up sending people into a vicious cycle because all of those behaviors end up fueling a depressive state, and much higher levels of suicidal ideation, not necessarily that people were making suicide attempts as much, but very high rates of wishing to be dead and not feeling that they had resources that were adequate, both internally and externally, to cope with the threat. In terms of substance abuse, and I want to also add that it's abuse and misuse. So we had a lot of people who had, prior to the pandemic, access to treatment facilities, 12-step and support groups, who got cut off from their support and didn't feel safe in their homes, whether it's because they didn't have privacy, because their struggles were personal and private and family members were not aware or didn't feel safe for them to participate in some of those supports, that there was an increase in substance use because they didn't have those support networks in place. We also see that substance abuse really helps to depress the nervous system. And so if our nervous system is constantly on guard and constantly being triggered, that people were turning to something that was very easily accessible during the time of the pandemic. It was one of the few things that the stores were open, or people were able to either get alcohol, marijuana, prescription drugs, being able to either soothe very overwhelming feelings or to be able to just numb and disconnect. And one of the other things that we noticed is that we had a way of tracking when people were falling off the wagon, if they weren't showing up to program, if they weren't showing up to their job, when people have lost their job and their home and they are not engaging in any other activities. It's very hard to actually notice that people were experiencing the substance use to a higher degree. Family violence, and which includes intimate partner abuse, child abuse. We saw very high levels of family conflict and dysfunction, and it was very directly connected to loss of jobs, loss of structure, and that family members, their own mental health conditions were exacerbated, and then they were all in very close quarters. What we noticed is that a lot of people who prior to the pandemic experienced family conflict had a way to get out. Even if it was for hours at a time, they went to a job, they went to the gym, they went to different spaces. Here, there was really very poor boundaries at home, no privacy, and nowhere to go. And also, again, another example of where people on the outside would tend to see symptoms, whether children at schools with an adult at school would see that something seems off or peculiar with the child, or that someone shows up to a job and is noticing certain signs and symptoms that no one was really able to discern that something was going on because everyone was at home. And oftentimes, just speaking as a therapist, there's very little that we can really see from a screen. And so we weren't actually able to see certain signs, certain marks. We couldn't see sometimes if people were losing significant amounts of weight, or if their eye contact was off because it's a computer and they were looking at the video the wrong way, or their eye contact was off because they were on drugs or because they were feeling unsafe. And just to talk about family conflict, we actually had clients that couldn't access treatment because there was no safe place, or because they weren't really given the permission to participate in treatment. We had a client that hid in her closet in order to participate in sessions and to try to get some of that support. Loss, which is also such a huge underpinning to why you're seeing such an increase in mental health symptoms, is because loss is everywhere. And I think that there was loss for every single person who went through this pandemic. But I also want to, highlight the traumatic loss that so many of our clients experienced, where loved ones were in hospitals with, whether it was sudden or it was a medical diagnosis, where they were losing loved ones and not able to be with them, not able to be with elderly family members, not able to provide them with the proper medical attention that family members wanted to give. And then really the significant and traumatic grieving process that ensued, and that still continues today. I just participated in a Hanukkah bereavement program that the Jewish Board sponsored last evening, where families, a lot of them were reaching the first year site, the first year where they're remembering a family that was lost during the pandemic. And they just continued to talk about the trauma of not being able to have a normal Shiva, not being able to go to the graveside, not being able to mourn in ways that are ritualistic rituals that are very meaningful and very healing. We had clients that are still holding on to a lot of guilt for, did I do the right thing with my parent or with my family member? And that they're just holding on to that. And then there's this ambiguous loss, the ambiguous loss of our routines, our resources. I think that the impact study talks about relationships and connections to synagogues and to the Jewish community. But I think that with that connection came a lot of loss to the ways that we celebrate in community. It took a long time to find alternative ways for that to happen, but that not being able to go to synagogues, family celebrations really created a tremendous impact. I want to highlight a few challenges that are specific that we noticed over time. One of them is that the helpers were hurting. Because this pandemic hit all of us, I think that something that was very profound for me was we didn't have a code book. We didn't have a rule book. We didn't know how to go about this. And especially we didn't know how to go about going on to telehealth, dealing with a global pandemic, while we ourselves personally were hurting. And that was a tremendous learning curve, and something that continues to remain a challenge is that the helpers also need support and are going through all the mental health symptoms that were being described and the challenges that are being described with their families, and yet also are tasked with this mission to try to help vulnerable people as well. There are many challenges with telehealth, but I do want to note that with more of our vulnerable families, we had a lot of poor reception, people who didn't have access to, whether it was internet, to devices, to the systems that would allow people to be able to access telehealth. Privacy was a big thing. We work with a lot of families, and I highlighted the ultra-Orthodox community as being one of the populations that held challenges. There were many individuals who live in one household where there was either no internet or no virtual platforms that were being used. And that was for religious reasons, or that if they were using virtual platforms, there was one phone and there was one tablet and there were multiple people in a family. And so telehealth is also very hard for specific populations like children, for people with mental illness, for children and adults who are on the spectrum. So we really found that telehealth, while it allowed us to reach people during a time of need, it also presented many challenges. I want to highlight the special needs population because I think that when there are parents who are caring for children, or even we have adults with special needs, it created such a tremendous emotional stress for the parents. In addition to the children, these children really need to be in programs. It does not work for them to go on a computer screen. And many parents had to not work, try to care for these children who were really overwhelmed by the impact of their life dramatically changing, not really understanding what was going on. And for many of what we did when the client was the child in the pandemic, it shifted that we were really supporting the parents who were extremely distressed and overwhelmed. I also want to highlight clients who have physical disabilities. We've had clients we had a client with cerebral palsy who also had comorbid OCD, depression, and a chaotic family life, where she wasn't able, there was no one working, there was high levels of tension and stress, but that it exacerbated her physical disability. She couldn't even get out on her own to do the things that some people who had more ability were able to do during the pandemic. And some of the other things that I will just note, but don't have time to go into, is that we had clients who were in the middle of court proceedings, dealing with the legal system, whether it was because they were trying to seek protection for them and their families, or because there was some case opened against them and they were maybe trying to regain custody of a child. That also contributes to very significant anxiety and depression symptoms. And that what we also found is that programs that provided higher level of care, like intensive outpatient mental health facilities or substance abuse programs, were either closed, went virtual, were not letting people in for a long period of time. And so people who actually needed more intensive treatment weren't getting it, and that impacted them and those around them. So what did we do, and what are we still trying to do, is that we have and we continue to provide training to our therapists who are on the front lines to support themselves during this process, and also to know how to live in a pandemic and that this ever-changing face of the pandemic. We have had to find ways to be adaptable and creative with telehealth. We've had to shift our clinical interventions to the new realities. We specifically have created support groups to address the impact of the pandemic. And so over the course of the pandemic, that has shifted, and we are always asking our clients, what do you need? And also our community partners, what do you see as being the needs for a group right now? But to highlight that, I didn't mention that a very vulnerable population is the elderly, those who are very isolated, didn't have family or support. And so one of the things that we did was had social workers who created the Friendly Callers program and reached out, whether it was through community centers or synagogues, to elderly members who needed check-in and support, and to see, what do you need? Concrete services? Do you need mental health services? And I do think that there is a really big overlap between people who need concrete support, whether that is through housing, food, finances, and their ability to cope or deal with their mental health issues when they have this very strong concrete service need or stressor. We were also really grateful to receive additional funding from the UJA through the Upward New York grant to be able to increase our services of case management, short-term counseling, and resilience training at yeshiva day schools, at the synagogues, in our JCCs. And I just want to highlight that the resilience training is something that is very important, because traumatization happens when we don't, and increased mental health symptoms happen when we don't have enough resources, both internally and externally. And we created a training for teachers, parents, and then a parallel program for children around how do we learn how to manage the stressors and cope with this unending level of uncertainty that is around us, so that we can be more resilient, that we can cope, and that we can manage and we can care for ourselves during this time. And just to end, I want to think about what's next, or what we still really are contending with. We need to increase our capacity to service those in need of mental health treatment. Mental health clinics are dealing with very high wait lists because of the number of people that are seeking care. And it is a mission of all service providers to try to figure out how to increase capacity. There needs to be more psychoeducation across the board around the long-term mental health impact of the pandemic, and also how to access care. It is amazing to me to know how many people really don't know where to turn. And I think Alex had mentioned the hand-holding piece, which I really agree with, is that when we are on site in a center, in a school, in a space where we can connect with individuals and really handhold them, I have found that to be the most significant way to link people to successfully to mental health treatment or to whatever other types of support they need. And I think we need to bring more of these services to where people are versus expecting the people to come to us. We need to go out to communities and bring the services to them. And I just want to end with something that I believe very much is that as a mental health professional, we need to be the bearers of holding on to hope, and really also encouraging this idea of post-traumatic growth. And especially as we live through with a pandemic, that during hardship, we can build resilience and we can learn what our strengths are. We can learn new ways to cope. We can be more creative and more able to respond, to repair, and to better manage, and to find that we are growing and that we can be stronger for it. And that, just to end on that note, is that there is light, and that a lot of people have found that when they look back, that they can identify some way in which they have been able to grow or learn a skill or be creative or have been grateful for the support that they have received.
Great. Are there any other questions? No? Well, then I want to thank all our panelists for a very important and enlightening presentation. I am so happy that we're going to have a recording of this session and make it available to our fund holders. In closing, I just want to remind everybody that if your family and friends are looking for a way to make their philanthropy easier to manage and more tax efficient, please consider recommending JCF. We are the only donor-advised fund that makes a significant annual contribution to UJA-Federation of New York and to Jewish communal organizations, providing a double bottom line for fund holders. And only JCF provides the outstanding personal service you've all experienced. I encourage our donors to please get your contributions and grant recommendations in as soon as possible so we can ensure that all your charities receive funds before year end. And also just a reminder that JCF will be closed on Friday, December 31st. So I want to again thank our panelists, thank all of you for participating in this webinar, and wish you all a very happy Hanukkah. Thank you.